Mhm.
Hey everybody, I am joined here today with Dr. Kimberly Evans over at Sugarland Medical Spa. You can find them at sugarlandmedicspa.com. And so we're here to talk about their treatments for ED, along with some of the main causes and questions that patients usually have. So Dr. Evans, thanks so much for joining us today. Really appreciate it.
Thank you. It's my pleasure. Thanks for having me, Caleb.
Definitely. And yeah, I wanted to just start things off by asking about, your experience working with these patients and what got you into these treatments and being able to help them with this.
Absolutely. So I've been in practice more than 20 years. My background is actually OBGYN, and I realized that there was a need in my community for sexual wellness and sexual health. So there was a lot of other doctors that were out there, but no one was really taking the time to focus on these things. And everything with change in life things. Um, a lot of doctors were like, hey, you have this problem, here's this medicine to fix it, but really kind of getting down to the root of the problem, and helping people make things like lifestyle changes and, getting into like regenerative therapies as well as other things, along to help with sexual health. Those were really huge for me because again, no one was offering it. So as I was able to help my ladies along, their guys start wondering like, hey, what's going on? I need to be able to catch up with this. So then I start including, a bunch of things for men too. So we've really been able to help change the lives of so many men. And it's been a huge blessing to be able to help our couples as we have.
Mhm. Definitely. Yeah, I can imagine you make a huge improvement in their relationships too.
Totally. Yeah. They joked with me and said, oh my goodness, Dr. Evans, you saved our marriage. And, you know, I have my wife back and I have my husband back. So it's a really cool feeling. It's something to where I think that certainly a lot of us doctors, we do our best with the tools that we have to grasp from, but it's nice to be able to go a little bit deeper and help people on a whole nother level, literally.
Yeah, absolutely. And I wanted to ask too, what do you feel like it is that really like these treatments and really, ED in general doesn't get talked about very much between, most patients and their primary care doctors?
Absolutely. So I kind of alluded to the fact that, with the whole healthcare field, it's very hard. We're very, very constricted. We're typically required to see so many patients, and it's even harder when we're employed by, a physician or there's someone over us to where we really can't take the time to review their history and then really help people make wise decisions about their health care and then be able to turn around and then offer them those certain therapies. So, we have the constraints of, the outside world, but now we're able to say, hey, I actually can now be able to sit down with you, review those things. So a lot of guys, when they come in, they're shy. They ask if I can be their primary doctor. And I'm like, no, I'm here as a specialist. I'm here to help you with this issue, but you still need your primary care doctor there for you to watch out for things like heart disease, diabetes, to make sure that they're doing all their positive things. So, but I'm definitely here to back them up and to listen to them. And that's the most important thing that we as clinicians will have problems with because we're so busy. It's hard just to sit down and listen. And when you look at their whole structure, you look at, their social structure, how are things going on, at home, are they having trouble with their family? Are they having trouble with, their job life? And then what can we do to help alleviate some of those things? Whenever you kind of drill down in that, then things start to reveal themselves, such as, these are the best things for that particular patient to help them the most.
Yeah, it definitely makes a lot of sense.
Mhm.
And so most of the causes that, patients are suffering from ED from, is it usually, like lifestyle related, or what do you find are really some of the main causes of it?
Absolutely. Definitely lifestyle related. So our diet is bad, and it's hard. We're actually down here in Texas, so it makes it a little bit harder with there being so many great places and barbecue spots and things like that. But the key thing is that, if we can help men be healthier and they can live better and they have more energy, they have more stamina, they're thinking better, they're more productive with things like that. With that base of energy, now guess what? You have more energy to take better care of yourself. So you don't have problems like heart disease and you don't need to be on blood pressure issues that lead to problems with ED, you know, um, less problems linked to causing hardening of the arteries and atherosclerosis and things like that. And then for a lot of guys, even when they want to be more sexually involved, they're just simply too tired. So again, lifestyle plays into that hugely. So, this is why I feel that it's important to have a variety of things to offer people to be able to help them, feel better and just have an overall outlook about the best options for them.
Yeah, definitely. And so did the treatments, modalities that you focus on really just depend on, their unique health history and what's going to make the biggest difference for them?
Yep. Every treatment is really customized. I've told men no before for some therapies, like we shouldn't start there.
Mhm.
I think one of the key basics to start with is usually hormone balancing. That usually helps give them back, first of all, the energy and the focus to be able to take the medicines that they need, to get the exercise in that they need. And then from there, it's very easy to add on other health things. But of course, they work better when you have a good basis to start off with.
Yeah, absolutely.
Yeah.
And so for patients that, are having an issue specifically with, ED and like a blood flow issue, what would really be the main treatment and modality you'd focus on for them?
Yep, exactly. So blood flow issues, perfect for things like the P shot.
Mhm.
There are other things that are out there, but literally again, let me back up just a little bit. So the main causes of ED could either be a nerve problem or it could be a blood flow problem. Nerve problems are very difficult to treat. They can be things like multiple sclerosis. They could be someone who had prostate surgery and now there's nerve damage that's there. So those require definitely a much higher level of like a urology and surgery type of input in order to help those guys be productive. If it's just simply a blood flow issue, then we have various things such as, I mentioned the hormone balancing, the P shot, things like shockwave therapy. All those things can help those issues.
Definitely. And are the blood flow issues usually caused by like, diabetes or hypertension or something like that?
Yep, exactly. Or it's the medication that they're on, literally. Yeah, totally.
Yeah.
Totally.
And so if they, are able to kind of like make lifestyle changes and start reversing some of that, is that usually resolve the issue on its own, or is there sometimes like damage that's occurred that needs to be addressed with something like the P shot?
Well, the benefit of the P shot is it's thought to be more of a regenerative type of therapy. So I don't know if anyone kind of described it like this before, but when you give the P shot, it's basically your body and it's broken down into healing properties within that blood. And that blood is then given back to the penis, which then tricks the body into thinking there's an injury. And then all of a sudden, you have all of these healing properties that come to that area. So, men, as they age, just like with women, they can have problems with sensation issues. They can have problems with getting an erection. They can have problems with maintaining an erection, things like that. So, if you're able to heal that area, if your own body is able to heal that area, then guess what? Things are functioning better in that area. So yeah, that's basically how the P shot works.
Yeah, it makes sense. And I know
Mhm.
for some patients they've had things like Viagra and Cialis, and those can work,
Mhm.
for some patients, but this sounds like it's more of a kind of a longer term solution where those are more temporary, right?
Yeah, that's absolutely correct. So, Cialis or Viagra, you have daily dosing, you have dosing as needed, but the P shot is something that can last a year to even 18 months. I have some guys who usually get it yearly because we know that aging doesn't stop. So as long as we're aging, why not do it gracefully and just stay as healthy as we can as possible to help maintain things?
Yeah, absolutely. And I think probably the number one question that I'm sure a lot of patients, ask and are wondering is if there's any, pain associated with it or any like unwanted side effects from it.
Great question. So I'll start with the side effects because we're basically drawing someone's own blood. Side effects could be things like just mild bruising, mild, temporary discomfort at the site of either blood draw or where the PRP is actually injected. In addition, because it's someone's own body, we're not adding any additives. It's, basically processed in an FDA approved kit without any fillers. So there's basically no side effects. And Dr. Reynolds himself, he's done studies that basically show there was no major complications with this type of procedure. And then the other question you asked for me was, what was that again?
About the if there's any pain associated with doing it.
Yes. Okay. So what we do, and everyone does their P shot a little bit differently, despite the fact that we've, are trained by the Cellular Medicine Association. So With us, what we do is we numb guys up in 3 different ways. We actually, after getting the informed consent, making sure that they're great candidates for this, because again, I've said no for some guys before, we actually give them a numbing cream to actually apply. After they apply the numbing cream, we actually numb them up more with lidocaine. And then there's like a third numbing thing that we use. So we basically make it so they don't feel anything, but we actually make it so they don't care too. We actually use what's called Pronox. And Pronox is something where it's like an inhaled anesthesia. It's basically the same thing that you get when you're at the dentist's office, nitric oxide. And a lot of times the guys, when they're doing this, they're just giggling the whole time. They're making jokes. It's they're teasing me as I'm doing this procedure. They're like, yeah, Dr. Evans, they're just making jokes about what they're going to do when they get home, basically. So it's, it becomes kind of fun, and it becomes more of an enjoyable experience versus something to be feared, per se. And that's really helped a lot of guys. It helps ease them, and feel much better about actually doing the procedure. And then usually they're telling their guy friends about it, and, how they had their success. So it's just cool. It's just cool all the way around.
Yeah, definitely. Yeah, I think that was really smart to implement, the use of that and being able to offer that for patients, because I'm sure a lot of the kind of hesitation is just that anxiety about it initially.
Totally. Yeah, exactly. And then too, if their spouse is near there or their partner's there, we actually can invite them in too, just to like be right by their side and also tell them jokes while they're, inhaling the gas.
Yeah, does the spouse get the gas too, or just the person doing it?
Oh, just the person doing it, of course. But mind you, yeah, literally they're just cracking jokes like back and forth. It's very cute to watch their interaction and their closeness that we
Yeah,
see.
I
Mhm,
can imagine.
mhm.
And so, do you usually recommend a certain number of like series of these treatments, or is there like a certain number? Does it just depend on, how many they necessarily need?
Yeah, it's kind of patient dependent.
Mhm.
Certainly the older guys, it may not last as long just because the simple quality of their healing proteins, they're just not as much. So they may get like a good year out of it. Versus I've had some guys that are younger, like in their 20s, they technically can wait, 12 to 18 months. However, I've had, some guys before where they would just come twice a year just because they just like it. They like the sensation. They like to feel, more youthful down there. And it actually can help, increase the size too, as well as the function. So they really like it.
Yeah, yeah, I can imagine. And so, I
Yeah,
mean, obviously, if you have them coming back to, do the other treatments, I think that speaks to the fact that it is, a very easy experience for them.
absolutely. That's true. Yeah. But honestly, when you do the P shot, again, it can last a year to a year and a half, but if you also combine that with other things, they'll get more of an effect, if that makes sense. So just like the pea shot alone helps with blood flow, so does the hormones too. So it's almost like a little bit of an additive effect, for both of them combined.
Yeah, definitely. Is that just because the hormones are able to help, in that rehabilitation process?
Absolutely. Anything that will help with blood flow in the area and help with the stamina, the performance, even the focus, and, not just coming home and just collapsing on the couch. Those are all things that really make the difference between guys' success and, just a little bit of success, if that makes sense.
Definitely. Yeah, I think a lot of those symptoms of hormone issues and then ED as well might be, guys just assume that that's part of the normal aging process and they're just going to have
Correct.
to deal with it. But it sounds like that's really not the case.
Correct. Yeah, they don't. They absolutely don't. Yeah.
And do you usually recommend any other like treatments or any other homework for them to do to really, get the most out of this?
Yep, absolutely. So key thing is that I really advocate is they have to be healthy. So for example, I've diagnosed some guys with diabetes and they were like, what? My primary care doctor never told me this, or they haven't seen a primary care doctor for months, which is like, oh. So, but luckily, because I see them for their hormones, they're usually pretty, they come back pretty regularly to see me. So it's actually, they claim that I'm the only doctor that they usually keep their appointments with me. It's like so funny. But nonetheless, so yeah, getting healthy, weight loss is important too. There's actually sayings that says, for about every 30 pounds of weight that you lose, you can actually gain a hidden inch of
Mhm.
penis that's now there. Combining it with other therapies such as shockwave therapy. I mentioned that earlier. That can help break down some of the plaques that could be there. Hormone balancing, we already mentioned. And another thing that we have too, for some guys, especially guys that have a history of prostate cancer, we actually do have the MSLUT. It exercises their pelvic floor. There are some independent studies that some urologists are doing that actually says that that's another thing that helps with the pelvic thrust of guys, which can then help sexually. In addition, of course, if you don't have too much urinary incontinence to worry about, that's something where guys could feel a little bit shy about. But now, guess what? We can actually do something about that. So those are things that are huge. It is FDA approved for guys. And again, by just having a network of different options to choose, that's how we can really customize our treatment to fit the perfect guy.
Yeah, absolutely. It sounds like there's pretty much a treatment and a kind of protocol for really wherever the guy is at, whatever
Yep,
symptoms they're experiencing.
totally, totally, totally.
Yeah, that's awesome to hear.
Mhm.
And in your opinion, when should a guy really be, seeking professional help and trying to be, find treatments like this?
Absolutely. I think for most things, it can be as soon as something becomes bothersome.
Mhm.
So I've met with some guys in their 20s, my oldest guy is in his 80s.
Hmm.
Yep, exactly. So there's just a wide spectrum of guys that we're able to help and give counseling to. Of course, it is important to review the guy's history because sometimes, they're not good candidates for this. Like, for example, if the diabetes was uncontrolled, I would make them go get help for their diabetes first,
Hmm.
or I would be working with their general doctor to make sure that, hey, we're tag teaming so that then again, they can get the best results,
Mhm.
from the therapy.
Definitely. Yeah, I think that's interesting. You mentioned that you have as young as 20 and as old as 80, because I think the younger guys probably assume I'm too young to have this problem and get treatment. The older guys probably think I'm too young to have any enjoyment
Totally.
or
Totally. Yeah. It's a huge wide spectrum. But I always find, the guys and the girls, there's not too much different. We all want to be loved. We all want to be taken care of and make sure that we're healthy on the inside.
Mhm.
My guy patients, they're always a little bit more shyer than the ladies are more forthcoming. Usually it's the ladies that are dragging the honeys in. But when they find out like, hey, I'm not alone with this. There are guys, that are just like me that are
Yeah.
going through this. And then they want to know, well, where do I start? Yeah.
Absolutely. Well, I think
Mhm.
for any guy that's, thinking that they're the only one dealing with this, they can look at how much money goes into the marketing for like Viagra and Cialis and really how much of
Yes.
a household name that is. I mean, it shows how prevalent of an issue it actually is.
Totally, yeah. So in my opinion, a lot of this stuff, it's really Viagra and Cialis can only do so much. But
Mhm.
if you're actually trying to heal the area and you're trying to really fix the root of the problem, that's how people get better for like the long haul. There's nothing wrong with still continuing the Cialis and Viagra as long as as long as it's appropriate patient for that, but you still get better results by addressing the underlying problem.
Yeah, absolutely. And for patients that are really ready to take that first step and come in for a consultation, what would be the best way for them to get in contact with you?
Yeah, sure. They can call our office. They can visit us online. They can make appointments online. We're just totally here to help, and again, they shouldn't feel shy about things, but literally, I think we're able to really change some lives. I've even met with a lot of guys, they're actually really depressed about this, and we've been really able to change their life around.
Yeah, well, that's awesome to hear. Yeah, like we talked about at the beginning, I'm sure you're making a huge difference and you probably see that on them, from when
Oh
they
yeah.
first come to see you
Yeah.
versus towards the end.
Yeah. Best feeling. Yes, totally.
Eh, And
Mhm.
yeah, those were the questions that I had for you. Was there any last advice or anything you wanted to leave them with if they're, struggling with this, not sure what to do?
No, just pick up the phone, give us a call. I think that, definitely meeting with, your primary care doctor is definitely a start. If
Mhm.
it seems like the primary care doctor can't really be that helpful, just say, hey, where else can I go for more information? And you'll find providers that are out there that are offering things like the P shot that are specializing in sexual dysfunction, and we're all here to help. We're all here to be, to help make that person's life as successful as possible.
Definitely.
Mhm.
All right. Well, awesome. Well, thank you so much for taking the time to talk with us today and share the education on those treatments. I really appreciate it.
Yeah, no problem. Appreciate you too. Thank you so much, Caleb.
Yeah, of course. All right. Thanks again.